Hi, this is Alicia Bright. I'm back. I'm going to re-record the intro to glucose regulation because I understand the volume didn't work last time. The audio didn't work. So, giving it another shot. Introduction to glucose regulations. Vocabulary. Glycogen. This is the stored form of glucose. Gluconeogenesis is glucose creation. It happens in the liver, and that's how the liver raises blood sugar levels when blood sugar is a little bit low and you're not taking in food. Glycogenolysis is the physiologic process of breaking down glycogen to increase blood glucose to optimal levels. So your body has a lot of mechanisms to maintain adequate blood sugar. And insulin is the hormone that's produced by the beta cells in the pancreas that allows blood glucose to get through the cell membrane and into the cell where it does its energy creating work. So the body has a way of bringing up blood sugar levels and then of getting the sugar into the cells with insulin. Now, the term insulin resistance refers to a situation when there are not enough insulin receptors on the cells, or if the insulin receptors are not responsive to insulin trying to move blood sugar in. So glucose balance is, the process of maintaining optimal blood glucose levels. The body has mechanisms for doing this by itself, but of course sometimes those mechanisms go out of whack, and then we need to step in and help out. One point I really want to make here is that nervous tissue is very dependent on glucose, very sensitive to it. That's why you get hangry. You ever get hangry where you haven't eaten for a little while and you're getting a little bit hungry, but you're getting really grouchy? That's because your nervous system is irritated by a little bit of blood sugar on the lower end. Of course, that's not pathologically low blood sugar. It's just kind of the way we get. You get a little grumpy and we need to eat something. Well, somebody who's taking insulin is going to be having a lot more severe response. So insulin, as we said, is the hormone that facilitates the movement of glucose into cells and therefore lowers blood sugar levels by getting it out of the blood and into the cells. On the other hand, the mechanisms for raising glucose include something called glucagon, which stimulates glucose production in the liver and slows the glucose moving into the cell, and cortisol, which does a whole lot more, and we'll talk more about cortisol when we talk about Cushing's disease. So we have the three areas: hypoglycemia, which is low blood sugar, hyperglycemia, which is high blood sugar, and the Goldilocks zone in the middle, euglycemia, or beneficial blood sugar. Signs and symptoms of hypoglycemia include all kinds of things that you would be associating with irritation to the nervous system, reduced cognition, somebody's getting kind of spacey, tremors, diaphoresis or a cold sweat, weakness, hunger, headache, irritability, and possibly seizures if it gets low enough. So on the other hand, hyperglycemia, the classic signs are polyuria and polydipsia, or somebody who's making a lot of water out of their kidneys, using a lot of water to wash sugar out of the body, so that the kidneys are releasing a lot of extra water, more than usual, in order to lower the blood sugar level. Polydipsia is the body's natural response to losing all that fluid through the urine. Polydipsia, thirst, extreme thirst. So they're drinking a lot of water and they're peeing a whole lot. And nonetheless, if they're not drinking enough water, they could get dehydrated. These folks also get really tired. They can get fruity odor to their breath. This is why sometimes people who are very hyperglycemic are thought to be drunk. They're a little bit foggy in the head and they got this fruity odor in their breath. And sometimes they're mistaken for alcohol intoxication. The Kussmaul's breathing, the breathing in and out and in and out. So Kussmaul's breathing, if you remember to our acid-base lecture, Kussmaul's breathing, those really deep breaths in, really deep breaths out. Immediately again, really deep breath in, really deep breath out. Deep, long, strong breathing blows off CO2. So diabetic ketoacidosis, for instance, is a condition of metabolic acidosis. And the lungs are going to try and compensate by doing this Kussmaul's respirations, Kussmaul's breathing. These type 1 diabetics in particular will experience weight loss because the cells are dying because they can't get the energy that they need. These people are hungry and their wounds aren't healing right. They're not getting the nutrition that they need. So a lot of different conditions may result in blood sugar regulation problems. We're going to talk about type 1 and type 2 diabetes, and we'll also talk about Cushing's disease, Cushing's syndrome. But there's pancreatitis, which is also famous for creating sort of, it's called a pseudo-diabetes. If the pancreas is inflamed, the beta cells aren't making the insulin that they're supposed to make. This process reverses itself, so it's not a true diabetes. Other conditions, prematurity at birth, you'll learn about that in OB and PEDS in Junior 2. Your stress response will send up your blood sugar levels, getting ready for that fight or flight. Starvation, of course, sends them down. Different medications can have different effects on blood sugar. So, as we said, there are consequences for hypoglycemia, irritability, fatigue, mental confusion. So this is kind of really uncomfortable, ultimately can kill you. Hyperglycemia, the short-term consequences are the fatigue, dehydration. Long-term consequences of tending to be high blood sugars, these are often known as complications of diabetes also. Retinopathy, or changes to the circulation inside the eye. The microvascular changes that they talk about are exacerbated by high levels of sugar in the body. So if the blood circulating is carrying a lot of sugar, it'll cause inflammation in the arterioles and the capillaries and damage the microvascular blood flow to different organs. So the eyes will start being damaged. The kidneys will start being damaged. You'll start seeing peripheral neuropathy. And also some macrovascular problems, resulting in hypertension, possibly cardiovascular or peripheral vascular disease. So diabetes, for instance, is a risk factor for peripheral vascular disease. So, question for you. What's going to kill you quickly? Hyperglycemia or hypoglycemia? Say you had a patient with a blood sugar of 420 and another one with a blood sugar of 60. Which one are you going to go see first? Well, I hope you said you're going to go visit that patient with a blood sugar of 60, because hypoglycemia can kill you really quickly, but hyperglycemia will do it too. It just takes a lot longer. Diabetes is affecting this is actually dated. This is kind of an old date. So there's a lot more people that are now affected by diabetes than 23.6 million. I should update this slide. It is the leading cause of end-stage renal failure. It creates an increased incidence of stroke. But diabetes in general is a group of metabolic diseases characterized by hyperglycemia due to problems with insulin secretion, defects with the action of insulin, or both. And actually, recent research is saying that there are up to perhaps 5 types of diabetes. And they show up a little bit differently. At this point, we're going to look at it in terms of 2 types of actual diabetes. And then maybe during the course of your career, this will change because there are some differences between classifications of diabetics. Diabetes type 1 is a disease of insulin deficiency. The pancreas isn't making it. It is an autoimmune disorder. There's no way to prevent type 1 diabetes. It just happens. People develop the antibodies against insulin and or the beta cells. in the pancreas. Type 2 diabetes, on the other hand, is a disease primarily of insulin resistance. It has a strong association with obesity, but not everybody who has type 2 diabetes is obese. If it is related to obesity, it can often be managed by exercising more, going on a very careful diet, and losing weight. However, it often requires anti-hyperglycemic medications. And sometimes we treat type 2 diabetics with insulin. We always treat type 1 diabetics with insulin. That's their problem. They just don't have it. So we have to supplement their insulin.